And lastly, I would say look at things beyond uh, the hospital sector. Look at public health, look at government, look at big pharma, look at biotech, health tech. There are so many companies out there that are doing amazing work. And sometimes I feel like within the healthcare administration community, we silo ourselves into that niche, right? And that could bog us down, especially when we're looking for jobs and everything like that. So definitely looking into other sectors and trying to, look at different courses, right? So I'm in product management, and I don't have any product management experience or anything like that, right? But the company saw the value that I brought to the table, and they were like, okay, well, let's hire you on from there, right? And but from the other perspective, what I could have done was taken a Google certification course on product management or project management.
Today and for joining us, Zainub. So I was looking through your various different positions and whatnot, and I found it really impressive, to be honest.
Thank you.
Various different positions at UCLA, Loma Linda. You worked in health policy at, for the city of Rialto.
Yeah.
It's really cool. And also you're a coordinator for a children's fund.
Mm-hmm.
So impressive. And I noticed you started out with your educational career.
Yeah.
In a similar way that I did, actually, because it looks like we both started out studying biology.
Yeah.
As a bachelor or a bachelor's degree, and then we moved on to getting an MHA. So
Yes.
would you be able to kind of give some sort of like intro and insight as to why you went down that route, and then maybe you can give us like the story of your career.
Of course. So as you mentioned, I graduated from UCLA with my bachelor's in human biology and society. When I originally went in as biology because I wanted to go down the med school path, because in my culture, I guess, or in my community, right, we have like three pathways everyone goes down, which is, being a doctor, being a lawyer, being an engineer. And this is an issue that we were seeing a lot in our community, is that we have so much representation within three of these communities, professional communities, but when we go into things like tech or social media or even media in general, we don't really have anyone that we can really turn to in those areas. So, and for me personally, I love biology, but I was very bored in those classes. I didn't really see the relevance, the application of it into real life. And that's how I went down to human biology and society, where it was a new major under the Institute of Society and Genetics. And we got to really see the intersectionality of how science was impacting the way the world was working. Like a big issue that we discussed was gene editing, and what genes are we saying are appropriate, right, for our community or society, and which ones are we negating. And we had discussions about Culligan versus Madrigal, where LA County hospitals were for sterilizing Latinx women. And this is something that was a huge issue. Another issue that we talked about were the autistic community. Are we saying that people who identify who are autistic, are we saying that their lives are not worthy and we could edit those genes out, quote unquote, in the embryo? So that was something that was definitely interesting. And it opened opened my eyes to the different perspectives that you could take in terms of career. So for me, I was looking into law or genetic counseling or going to med school in general. And so after undergrad, I didn't really have like a path. I didn't know what I wanted to do. So during my gap year, I ended up taking a full-time position at a nonprofit called Children's Fund, which is located here in San Bernardino County. And what we do necessarily is provide resources to children who've been abused and neglected within the county, and San Bernardino County is one of the biggest within the United States. And through that role, I got to really see how policy affected children who are the most vulnerable and the most underserved, and how the businesses and the economic impact of ensuring that we have people who are advocating for them. We have these resources available, and we're also able to ensure that they are making a meaningful impact into the community that we serve. So that's kind of how I got into, Children's Fund. And for me, pursuing an MHA is definitely a huge turn, I guess, from going nonprofit world. So for me personally, my mom had a stroke in October of 2018. And, we were at Arrowhead Regional Medical Center, and I was there with her for a week, trying to figure out what happened. And, I just saw that the people who were making these decisions in the C-suite or the donors, whoever it may be, they didn't really necessarily reflect those who were actually in the patient beds. And I felt like in general, there was a disconnect between the patients that we're serving and the people who are making these decisions. Of course, they know how healthcare works, but on a level, what does that mean to the community? And I think that really impacted me and led me to apply for my master's in healthcare administration at Loma Linda University. So that definitely was a big shift. And throughout Loma Linda University, we are required to, work at different sites. So one of my first sites was at San Antonio Regional Hospital, where I helped restructure the cancer survivorship program there and present those recommendations to the tumor board. So that was a lot of research about understanding cancer, the disease itself, understanding what it meant for a survivor, because life completely changes for a survivor. There's emotional impact, psychological, financial, and anything you can name it. And I think something that we constantly neglect is just as much as cancer affects, the person, it also affects the family, the caregivers, the people who are important in their lives. And that's something that hasn't really been studied as much as I think it would be nice to. And then on the other hand, after that, I applied to be a Randall Lewis Fellow because I wanted to understand the intersectionalities between policy and public health. And that's how I was positioned at the Rialto City Clerk's office, where I helped address food insecurity within the city of Rialto. And something that I jumped in on was managing the farmers market. So from there, we accepted, California has a program called Market Match. So if a person has an EBT card, they can come to the farmers market, take out a minimum of $10, and then also have an additional $10 for the Market Match program to utilize on fruits and vegetables or anything that they need at the farmers market. So they're extending their dollars, right? And of course, where the economic impact within the city of Rialto was that we're bringing in fresh food. We're bringing in vendors who are local to the Southern California community. And, we're increasing awareness and the holistic health, right? Because, I feel like sometimes healthcare, we live in a silo. For many people, health is just, the doctor's office. But in reality, we don't realize that health begins at home too. And that was something that was amazing to talk about and to see in action. And then from there, we started a social media campaign highlighting different national months, I guess, talking about like National Fruit and Vegetable Month or National Salsa Month or National Picnic Month, right? And just to enable people to realize that, health is definitely a wide-ranging topic, and that we can definitely utilize our resources within our own city to ensure that we are, serving as many people as we possibly can. And then the project that I left off with, I wasn't able to complete, unfortunately, was an employee walking program. We felt that because of COVID, we spent so much time indoors and didn't really get to go outside and, be active. So I'm glad to see that I laid the foundation out for that. And hopefully the next Randall Lewis Fellow will be able to pick that up and go ahead and start working on that as well. Sorry, that was a lot of information.
That was great. Wow. No, that's very impressive.
Yeah.
So UCLA and Loma Linda, your two positions there. To be honest, coming from the Inland Empire and also knowing my students, having any really position in these organizations is really something very impressive and something that someone would get really excited about. And I mean, I know that all of my students are constantly going, oh, if I can only work at Loma Linda and everything like that. Can you talk about specifically what you do for these, or what you have done for these two organizations, the positions you've had? And also, what were the stepping stones that helped you get in the door?
In terms of like the university or in terms of like the positions that I've held?
In terms of the positions that you've held,
Okay.
do you think that it was mostly because you went to the universities, that you attended those school institutions, that you were able to get yourself in, or were there other factors, networking, anything like that?
Of course. So I think definitely like the university that you go to is important, but also at the same time, it's also having that experience under your belt. So at UCLA, even though I was a student, I was still working on creating different organizations and initiatives on campus. So one big initiative that we started was called the Food Drive Initiative. So we noticed that we lived in Westwood and we have this bubble, right? We have Beverly Hills right here. We have like West Hollywood or whatever. But then, right, if you go right down to Venice Beach, we have a huge homeless population living on Skid Row. And we felt that, what are we doing to address this issue? And we know that, council, government, whatever, the wheels turn slow. So what can we do as students to help this issue? So what we started doing was a sandwich bags that we would distribute to Skid Row residents. And by the time that I ended up graduating, we had distributed over 1,000 meals. And that's something that, that is kind of unheard of, especially for a student led initiative. On top of that, I was part of different organizations such as Volunteer Project, where we went to different site and locations within LA County. So a big one was Watts, and being a part of the clinic there, and definitely teaching health education and just seeing the impact of others who are seeking healthcare at a low or reduced price. And I think a story there that really stood out to me, I spoke to a woman about diabetes, and she said that her brother had just passed the day before from that disease. And it was just a shock to see that, she was here in the clinic herself now. And one other project that I was part of was called AMPD, which is the Academic Mentorship and Professional Development Organization. And we realized that we don't really know what's out there besides the set careers that we've grown up with. And that's something that we started a networking night to kind of bridge that gap between alumni and undergraduates. And then we set up a mentorship program between underclassmen and upperclassmen to kind of guide them, because UCLA itself is such a big campus. And you never really know what resources you have available. You don't know that people have books that you can borrow or tests that you can look over, and that definitely was helpful. And then from the academic side, books cost up to $200-300. And we created a textbook loan program. So all of those experiences, right, were experiences that I brought into that role at Children's Fund. And then when they saw that I had all these things, they knew that I was someone who was a self-starter, someone who took that initiative, someone who understood what it took to work in a team, right? And then that got the ball rolling, right? And on top of all these things, I was also doing research under the radiology department. I was also a part-time work study participant, right? I was working in the neurology department under the HR department, helping to do faculty reviews on a quarterly basis. So that was something that was instrumental as well. So I think first, to even get your foot in the door, you have to make sure that you're someone that they would want to hire at the end of the day. And of course, networking and talking to other people. I think that was something that was very intimidating, because I come from the Inland Empire, right? It's not something that we normally talk about or have that mentality of.
Right.
But at the end of the day, we know, we've seen the statistics that, getting these positions, like 80% of them aren't even like listed online anymore. So it's like knowing who to talk to and understanding that you can get 100 no's, but it's that one yes that matters and can set the trajectory of your career path. And I think that's something that I would have loved to have learned at a younger age, instead of constantly feeling imposter syndrome or feeling that I wasn't doing enough. And just knowing that I could have reached out a little bit beforehand and had that experience and had that capability. And then, again, at Loma Linda, I think that I had that a little bit more of that mentality. And being a part of different student initiatives and student organizations and talking to professors and feeling that they were actually there for me, I think that was a big difference as well, because going from a 200-person classroom to 13 people,
Right.
it changes. And also just knowing that our professors are definitely advocates for us. They talk about us even when we're not there, and it's funny because during my time at Loma Linda, I participated in a College Bowl competition hosted by the healthcare executives of Southern California. And, the past winners of the College Bowl have been UCLA, USC, other universities for the past couple of years. And we were like, Loma Linda hasn't won for 16 years, like this is the year, right? And we put our best foot forward. We took whatever we had learned both in the classroom and outside the classroom, and we put into presentation that definitely highlighted the competencies that we've learned over the years and over the course of our master's program as well. And we presented our first round. We had so many technical difficulties. We found that we were kicked out of the Zoom, so we couldn't get back into the Zoom meeting that had all the judges into it. So we had to Zoom through our phones, which was a little bit of a stressor because
Right.
we had practiced through the laptop and everything like that. And then so we did a presentation. We were like, okay, we don't know, we honestly don't know what's going to happen, the outcome. And then when they were presenting the 4 finalists, we were like, okay, that's not going to be us, right? And then they said our name last, and we were like, what was our team name again? Like, what was our team name? And so we were shocked at that. And then we were the last to actually present in the second round. And thankfully this time we were actually in the Zoom, itself. And it was definitely nerve-wracking because they said that give us 15 minutes, we'll be back and they came back in 5, and we're like, oh, they know who they picked, right? And then they're going through the list of people, and then finally they said Loma Linda University, and we were like, we won. It was just a shock. So again, so sorry to go back into that experience. So now that I'm networking with a lot of different people now within the healthcare administration community, I have had people come up to me and say, I've heard your name 6 different times, and this is the first time actually meeting you in person or online, via Zoom. And that's definitely shows that, the things that we're doing within, in college through our practicums, our internships, our work, people are taking notice of it. People understand that, whatever brand, quote unquote, that we're making of our professional career, people are taking notice of it. And I think it's important to put our best foot forward and know that the opportunities that we have to take advantage of them, because I've experienced other people within that cohort who didn't really necessarily take those advantages, right? And for them, it's a little bit of a struggle right now to get into those positions or network or anything like that. And I think just having that confidence of knowing you're in a master's program, you're learning the competencies, you're learning what you need to learn to be professional within this community, and also knowing that you have a fail-safe of your professors, your cohort, your friends to be there for you. Because we have this saying within our university, right? Everyone puts on their pants the same way. If you're a CEO, if you're an executive, if you're a student, everyone's the same. Everyone started off the same. And I think that, it's very relatable. And just as much as we're scared to go up to them, they might be scared to come and talk to us, So it's definitely a two-sided street. And I think that it's just being relatable. It's just knowing that I think that with networking, we've had this mentality that it's very transactional, right? That you want to get something from them. And I think now I have this mentality where, like, let's make a relationship, let's build something from here. And I think that's definitely helped a lot. And I think it becomes genuine.
That's wonderful. Actually, that is such good advice, to be honest.
Yeah.
Okay, another thing that I was hoping that you would actually discuss, because let's do kind of a comparison sort of thing, because I know that you sort of experienced, different types of organizations. So you've experienced the nonprofit, you've experienced working for government, you've experienced, a for-profit organization, pretty much all of it. What are the major differences, or through your experience, what can you really say about them? Like, especially like if you were speaking to like a young, someone in school, an undergrad.
I think the biggest differences that I've seen from the nonprofit and the governmental side, things are a little bit slower. I think that's something that I've had to learn over time, that coming in, I was the youngest as a nonprofit, I was the youngest person there, and I'm coming in with all these fresh ideas and everything like that. But I also had to temper myself, because I think nonprofits they've kind of dedicated their ways into how they want to run and work. And I think sometimes it's a little bit scary to be like, oh, let's do something different, right? So, and I can allude to this to my boss, actually. My boss at the time could have been my grandmother. You know, there's such an age discrepancy
Okay.
between us, but we had a mutual respect for one another because she hired me on because she knew I I wanted to do something different with the way that things were running there. And, I believe in this cliche, right? That um, actions speak louder than words. So I can talk about what I can do, what I can't do, but it doesn't matter as long as I can't deliver on it, right? So we have this policy or that we have to do year-end tax statements at the for a nonprofit, and our the processes that we had going in would take us 2 weeks, right? Because we had to constantly check and balance and things like that. And then I said to my boss or my manager at the time, I was like, let me show you a different way to do it, right? So it's easier, it takes less time, it increases our efficiency. So we took a 2 week process that originally, and it became a 2 day process. And I showed it to her and I said, let's do it this way from what I've learned and what I've understood. And she was like, okay, wow, let's do your way, and it kind of showed her that, the capabilities that I had, and it built that trust with her. But so again, with nonprofits and government, I think it does take a little bit more time. I think there are more checks and balances that are in place to ensure that money isn't being used in a way that isn't productive or efficient, and to ensure that the money that is coming in from our donors is being used in a way that is designated from them. Because of course, in nonprofit, we have restricted funds and unrestricted funds, and once a dollar goes into restricted funds, that's the only thing that it can be used for, right? But unrestricted funds, we can use it for other things like overhead or supplies, or even, going out generally in the community for whatever needs that need to be served. So I think that's something to take into consideration as well. And I think for nonprofit and government, I think you just have to have that passion and that love for the community. Because more oftentimes than not, it could be a thankless job. You can be putting in 40, 50 hour weeks, right? And it could just become a little bit daunting to think that we're doing so much, but what is it, the impact that we're seeing in the community? And I think that's something to definitely consider when going into or considering to go into this field. It definitely can become a lot. It can become overwhelming, but also knowing that there are people there that can support you in during that time. I think from the for-profit side, it's definitely more fast-paced. I think that it could be a little. I think for-profit can be more organized in the way that the structure is of the community of the work community, and for-profit, I believe that because there is more money within the business space, that there is a little bit more of a push for professional certifications or trainings or benefits, I guess, overall, because the position that I have now is in a for-profit in the for-profit sector. And that's something that I've definitely seen, is that it is a big company, but there are resources there for employees to utilize. And we're also able to understand that if we want to go out to a conference, that it would be paid for. If we want to go and get certified in something that is aligns with their position, then we're able to do so. And I feel like sometimes with nonprofits, I think that becomes a little bit not it becomes a little bit hazy, because they want to know where the money goes, right? Like, so of course they want to invest in you, they hired you, they invested in you, but of course they want to ensure that they still have enough funds to ensure that they can meet the needs of the community as well. So I think that's something, the biggest differences that I've seen in terms of like personally within my own career, I guess. But I guess I would also like say that everyone has a different perspective and a different experience as well. I know people who've been in nonprofit for 20, 30 years and they love it, right? That's like their calling. And I do believe that, sorry, and I do believe that, somewhere along the line, I would turn back to nonprofit work, just because I do know that I love the community. I love serving it. I love seeing the impact, and I love fostering growth. And that's kind of why I moved back to the Inland Empire, because LA was big, it was bustling, it was a lot. And for me, I just wanted to go back and give back to the community that raised me into the woman I am today. And it's nice to see that the Inland Empire has retained so much talent. I've seen friends that I graduated high school with and college with, and just here and thriving within the Inland Empire. And I think that's something to also take into consideration as well.
That is beautiful. Okay, so lastly, I just wanted to ask if you have any kind of advice that you would give to an undergrad, someone who's studying healthcare administration, especially those who are close to graduation, well, who are graduating now or even next year, like seniors or
Yeah. For sure. I would definitely say I have like 3 points I think that would definitely be important. Number one, build your LinkedIn profile. Make sure that everything's put on there. You have a professional headshot, your summary's on point. You have um, like accomplishments that are quantified. You list all of your skills and also have people start endorsing you, whether it be your professors, your fellow students, because that definitely makes an impact. And I've seen from jobs, they looked at my LinkedIn profile. I would see people from like UCI Health, right, or CHLA looking at my profile, and I was like, okay, then this is go time. My second point would be network. I think just put yourself out there. Start looking at people like Juan Solting who are big on TikTok and Instagram and LinkedIn and see what they're doing, because a lot of the people that they've worked with have gone to big companies like Facebook, Pinterest, whatever it is, Deloitte. And lastly, I would say look at things beyond the hospital sector. Look at public health, look at government, look at big pharma, look at biotech, health tech. There are so many companies out there that are doing amazing work. And sometimes I feel like within the healthcare administration community, we silo ourselves into that niche, right? And that could bog us down, especially when we're looking for jobs and everything like that. So definitely looking into other sectors and trying to, look at different courses, right? So I'm in product management, and I don't have any product management experience or anything like that, right? But the company saw the value that I brought to the table, and they were like, okay, well, let's hire you on from there, right? And but from the other perspective, what I could have done was taken a Google certification course on product management or project management, or I could have talked to people and did different projects on the side. So that will definitely be something that I take away. And I believe that failure is growth. So you know fail upwards. Like do things that make you happy and passionate about, and just know that a job is a job, but don't you have a life outside of it as well. So do things that are also you're passionate about, you have hobbies for, have a social life. you know I think that's definitely important. And that will definitely just elevate you and make you a stronger candidate when people know that you have other things going on in your life as well that you're passionate about. So yeah.
That's wonderful. That's perfect. Thank you. That was so helpful. Yeah, this meeting has been so resourceful, to be
Of
honest.
course.
So much.
Thank you.
Thank you for doing this. If anyone wants to contact you, maybe with
Yeah.
any questions or anything
Yeah.
like that, how can they do that?
So they can always email me at my email at Zainub, so ZAINUB, period, ALI 123 at gmail.com. Or they could always send me a request on LinkedIn as well. So my LinkedIn would be my first name and my last name. So Zainub, ZAINUB, and my last name, Ali, ALI. And we could definitely discuss any more over there. I've had people from my own cohort, reach out and ask for advice. I've had incoming, hopefully, fingers crossed, Loma Linda students reach out as well about personal statements. So of course, I feel like I wouldn't be in the position I am in if no one helped me. So of course, I want to give back and help others as well.
Mhm. Wonderful. Thank you so much, Elizabeth.
Of course.
Good luck with everything, especially with your
Thank
new
you.
job.
Thank you.
And
Thank you.
yeah, I will go ahead and
Much, Ashley. Have a good day. Thank you so much again.
no problem.
Okay. Have a good day. Bye.